Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Harita Reddy from Apollo Cradle and Children's Hospital. She is going to talk about cervical cancer awareness. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Okay. Good afternoon, everybody. Today, as a topic is regarding cervical cancer and its awareness. So, whenever we think of a cancer, like first thing that pops in our mind is what exactly it is, and what causes it, and how can we detect, and is there any chance to prevent it as well? And then, if at all we are detected, how to go about? What are the treatment options left? Today, in our session, we'll try to answer these questions as far as I can. And as you know, cervical cancer is the fourth most common cancer in worldwide. If you take it globally, like India, from India, like I can say the burden on India is around 24% amongst all the cancers. Like if you say take five women who are having cervical cancer worldwide, of those one is will be from India. So one in five is our contribution for this cervical cancer. And then like the most common thing that cause of cervical cancer is mainly due to infection. That too, it's mainly because of virus called human papilloma virus. There are almost more than 150 varieties of it, but not everything, not every strain would cause cervical cancer. Of those, we have got one. We have got few which are called low risk type, and there are some varieties which are called high risk type. And these high risk types are the ones which are mainly responsible for cancer. The moment when we say cancer thing is, first we should know when we can expect, when we should suspect that we have cancers. In that, like some warning signs are there, like for example, after having sexual intercourse, if you find having bleeding or spotting, then that's a sign that you need to consult your doctor as early as possible. Or you're having your regular periods, but despite your periods, in between the cycle you find bleeding, or if you find some abnormal discharge, or when bleeding is a bit abnormal, that means your cycle has been like regular, but then you notice some differences in the pattern of cycle, then you will have to then also it's an indication that it might need some more evaluation. Or when you find different kind of discharge, like usually a discharge will be there, vaginal discharge will be there, that can happen like before periods are expected, or during ovulation time, or immediately after menses. But other than this, if there is discharge and it is foul smelling, moreover, then that's a matter of concern. And if you find yourself losing weight without any obvious cause, like you're not on diet and you're not on exercise, but still, despite nothing, if you're losing weight, that also has to be taken in a serious note. And most of the times, this papilloma virus can also not cause any symptoms. That is another problematic thing. That means you'll be totally asymptomatic. Then, how to pick up is the next cause. Okay, and then how to pick up is the next challenge we have to. That I'll be discussing further in further session. Okay, and then so these are the symptoms, which are the early warning signs that will tell us that will prompt us to visit a gynecologist preferably. And then who are actually the women who are at risk? So when we say those women who are at risk are those who are having who already have this HPV infection, or those who are having multiple sexual partners, or where the partner already had some sexual infection, especially with papilloma virus, or those who have got multiple partners, and then those who are giving repeated births, those of belonging to low socioeconomic status, cigarette smoking, those who are maintaining poor personal hygiene. These are the women who are more at risk of developing cervical cancer. Then there are also low risk women where the chances of developing cervical cancer is less. For example, those who have never had sexual contact at all, then the chances of developing HPV infection itself is very low. Those who get infected, then there can be a chances of developing cervical cancer. Not all infections with HPV will lead to cancer. most of the times in 1 or 2 years they will get settled. That means all infections will not lead to cervical cancer, but unfortunately we don't know which infections can lead to cervical cancer. That is the next dilemma. Okay, so first thing is we have to take measures so that infection, like procuring infection, we can cut off. That is one way of dealing with it. And the other way is, like, if at all we develop, if we can detect early, then it can be treated early. Okay, so for that we have got what is called as pap smear. And that is like, that's an office procedure. Like, you don't need to get admitted for that. You need to just visit your gynecologist nearby, and then you'll be asked to lie down on the couch, and then we'll introduce a speculum in a gentle way. Then discharge will be taken, and that will be spread on slides, and it will be sent for microscopic examination. Okay, this is what is called as pap smear. And there are different varieties in it as well. There is what is called as conventional pap smear. There is what is called as liquid pathology. That will be explained to you just before doing the procedure. And then next question comes, whom all have to get this pap smear screening done? Why exactly this is done? This is a screening to that is done. When we say screening, that is, it is meant for healthy people. Like, those who are already having cancer, we don't do this test at all. This is for those women, as a part of routine, like how we get your routine blood test done, to see that whether if something abnormal is happening. In the same way, to detect cervical cancers, pap smear is advised. Okay, so this pap smear, we say that it can be started after 25 years, or at least after 3 years of initiating sexual contact. And this has to be done only once in 3 years. That means if you get your pap smear done in 2023, only after 3 years you need to repeat. Why is that there is so much gap? Because, like today when we do a pap smear, it might be negative, but then after few years there might be some changes happening. That means which was silent before might turn virulent later. That means it can cause some amount of disease. To detect those, we need to repeat it again, and this should go on till the age of 65 years. So like after 25 years we'll be starting it, and then that has to be done every 3 years. And there are also some tests which we combine and do. Then if we combine this HPV DNA and pap smear, it has to be done only once in 5 years, and everything beyond 65 we don't do. Because for the cervical, like once we get develop HPV infection, most of the times luckily in 1 or 2 years this infection will get settled. But if it has to convert into cancer again, it might take some 10 to 20 years. So you can understand that we have got lot of time period to actually identify whether we are having any infection or not. Okay, so that is the reason we do this pap smear. This is done at microscopic level. That means at microscope level we'll be able to detect it. So even we usually we can detect that even before the cancer starts. That is what is called as precancerous stage. Okay. Then after that, even if at all cancer is detected, that will be like at a very early stage, which we can do probably with surgery as well. That is the importance of pap smear. So when can we do that? We can do it at any point of time, provided you are not in your periods, because you'll be taking cervical discharge. So if you have periods, that job cannot be done. So we don't advise it to during periods, and at least 2 days gap must be there after having sexual contact, or like after vaginal douching, or even after periods, because we just take that cells which are falling in the vagina. Okay, for that these things have to be noted. That is regarding pap smear. That is one excellent way of identifying if at all cervical cancer is there. That can be picked up at very early stage, and then it can be treated accordingly. Okay, and most of, like, depending on the stage, like if it is not even before, if it's like at a stage when cervical cancer also has not yet started, then that can be even treated with simple measures like a cryo or ablation, depending on the stage, depending on the patient's condition. There are different options available. Okay, and then next comes like. How can we next comes the next question would be, how can we actually prevent it? Is there anything that we can prevent? One is by having sexual abstinence. perfect sexual abstinence, then almost there is nil chance of developing cervical cancer, like due to HPV virus. Okay. And the other way is, luckily we have got vaccines. Okay. And then when we say vaccine, like after COVID, now everyone is aware of what vaccine is and how effective it can be. In the same way, like cervical cancer also, like imagine a vaccine for a cancer. So it has to be, taken very religiously, as it's going to be of tremendous benefit. Uh, like uh, um, as due to financial constraints, like government of India has not made it compulsory vaccine. It's still an optional one. From but Indian Academy of Pediatrics, they have included in their optional vaccination schedule as well. So it can be given for both men as well as for for boys as well as for the girls. Next question is, why for boys when it is only for cervical cancer? When in vaccine we are targeting the papilloma virus, and this papilloma virus is not just responsible only for cervical cancer. And by the way, cervix is the opening of the uterus, we can say, in other words, like mouth of the uterus. It's not only effective regarding the cervical cancer, but this papilloma virus is also responsible for vaginal cancer, vulval cancer, genital warts, anal cancers, even penile cancers, and anal oropharyngeal cancers as well. Okay, as this papillomavirus can cause so many varieties of cancers, so it is important to get this vaccination done for both boys and girls. If boys can get it done, that will prevent them against developing penile cancers, as well as the chances of transmitting to their partner will also get reduced. Okay, for boys, it is recommended anywhere between 9 to 26 years. For girls, it is preferably before they have sexual contact. But better late than never. Before 45 years, they can get this vaccination done. Below 15 years, the dosage is like only two doses are needed. But beyond 15 years, recommendation says that it has to be given in three doses. That means, say, for example, first dose is taken in Jan, then after 1 or 2 months, say February or in March, second dose will be taken, and after that, in June will be the third dose. So in that way, three doses are advised for those beyond 15 years of age group. Okay, so then once we take the cervical cancer, like how far it is effective and what are the different varieties. Like there is what is called like bivalent vaccine, which can cover two strains. There is quadrivalent, which can cover four strains, and there is nonavalent, which can cover nine strains. The one which has two, that covers those most common ones, which can cause cervical cancer. And if you take these four strains, wala, the what is available right now is for four strains is Gardasil, Cervarix, and Gardasil 9 as well. These are different brand names for your information I'm giving, that you can opt whatever is available near to you. Okay. And this in quadrivalent, that is effective against both warts, that means low risk type of papilloma virus, which can cause these warts, as well as those which can cause cervical cancer. In nonavalent, it has got a wider spectra. It can cover up almost nine varieties of strains that can cause cancer. But due to cost constraints, it is again option. It is again totally up to you what you would like to opt for. Okay, so the next question is, once we get vaccinated, is it really needed to do this pap smear? Is the next question. So, like here, when you know that we are targeting only few strains, so far we have got our development only which can prevent cancer caused due to few strains, not due to all the varieties. So that warrants us to continue with this pap smear still. Okay, so because pap smear's role is to detect, okay, vaccine's role is to prevent. But if at all cancer happens, our target is to identify and treat it as early as possible. Okay, so as the roles are different, so both have to be done. Though you get this vaccination done, it is still important to get this pap smear testing done as well. And next question would be like I'm like already we are sexually active for more than 5 years or 10 years. Is it really needed to take vaccine at this point of time? Like as suggested, it was actually mentioned for those who are not yet sexually active. Say there's 9 years girls or 14 years girl. is recommended as early as possible, but better late than never. Like if at all you have been exposed to only few strains of this papillomavirus, this vaccine might prevent those strains which you have not been exposed. So in that way, we recommend it even up till 45 years. And so far, not much complications have been reported with these vaccines so far. Next comes like how can we treat? How to treat is the next question. So, like depending on the cancer stage, it is in very initial stage. Even in pre-cancerous stage, some might need just only follow-up. Colposcopy might be needed. That is still better way of evaluating it. And see and treat are the newer options happening, like cryo or ablation. So, depending on the stage, these are the different methods that can be involved, that can be offered to you. And once it is advanced, we may have to suggest you surgery. If it is too advanced, then we may have to even suggest you chemoradiation. That means radiotherapy as well as what you say drugs to sensitize the cells to respond better to radiation therapy. And the best way of thing is for sexual abstinence. So, then the common age group where we find people is like more than 30 years. It's not that it happens at a later age. So as age is more than like 30 years is the most common age group when we find the cervical cancer people. So we suggest that you be very regular with your pap smear screening. That will detect any small minor things, and that so that we can intervene early. And if at all you are detected with cervical cancer, and if you are planning for pregnancy, there are even some modifications in treatment so as to help you to get a baby, so that you can even bear a child and finish your treatment simultaneously as well. That again depends on how advanced your cervical cancer is, and how then depending on your general condition. These are the few things. And then the other methods of preventing cervical cancer would be, having this regular pap smear testing done, and saying no to cigarettes, and adopting a healthy lifestyle, eating plenty of fruits and vegetables, and using condoms consistently, and to restrict the number of sexual partners as far as possible. So these are some methods of screening or like preventing cervical cancer as well. And then what is the rationale for vaccination? Thing is like, as I told you, like all married women will have some amount of HPV exposure during their lifetime. Okay, then why is that we need to get this vaccination done at all? Thing is like, when we get this naturally, then the chances of development of immunity is a bit milder way. It's a bit weaker way. So like when we give this vaccine, antibody response is better than with what we get with natural infection. That is the reason that we are recommending this vaccination for women. Anything else or anything you want to know? Okay. Thank you for your patient listening. As this happens to be a cervical cancer awareness month, we have taken this opportunity as a method of public awareness program regarding cervical cancer. I thank everybody and wish you a good day.